Picture a medical mystery for a second. A physical pain so profound it literally fractures relationships. We're talking about a massive structural collapse occurring right inside the human body that causes millions to suffer in complete isolation. And yet, it remains entirely hidden, dismissed by our culture, and frankly ignored by medicine. In this explainer, we're diving into the dark, silent epidemic of menopause.
So you have to ask, why is the sudden, agonizing pain of intimacy that millions of women experience just brushed off as normal aging? The psychological tension here is absolutely staggering. Women blame themselves, you know? They carry this heavy burden in secret because they're told it's just something they have to live with. But let's be crystal clear right now, this is not some personal failing. It is a chronic, completely untreated biological crisis.
Look at this number, 84%. I mean, really think about that for a second. Up to 84% of postmenopausal women suffer from this condition. That is the vast majority. And yet, half of them have never used a single therapy. Zero. They're just left to suffer in silence. The clinical term for this is genitourinary syndrome of menopause, or GSM. Now, we hear a ton about hot flashes, right? But hot flashes typically fade over time. GSM is an entirely different beast. It's a progressive disease, meaning without active medical intervention, the thinning, the drying, the sheer pain, it doesn't go away. It only accelerates.
That brings us to Section 1, Anatomy of a Collapse, the death of a biological ecosystem.
To really grasp this, we have to zoom way in. A healthy vaginal ecosystem is incredibly robust. It's thick, elastic, packed with glycogen, and supported by this foundational pillar of estrogen. But what happens when you withdraw that estrogen? The architecture completely breaks down. We're talking severe thinning, cellular starvation, microscopic fractures. It isn't just discomfort, it is a total microscopic structural collapse.
And here is the exact cascade of failure. First, estrogen plummets. Because of that, cells are starved of glycogen. Next, the protective bacteria, the literal guardians of this ecosystem, they just die off. This causes the vaginal pH to spike into a harsh alkaline state, destroying the body's natural acidic defensive barrier. Once that happens, infection takes hold, and severe, tearing dryness begins. It's a domino effect.
Which leads us directly into Section 2. The architecture of pain, a body defending itself. This introduces something called pelvic floor hypertonicity. Basically, it's involuntary muscle guarding. When the mechanical friction of intimacy hits those dry, fractured tissues we just talked about, the body panics and throws up a shield. It triggers this reflex of chronic tension. The muscles literally lock up. Blood flow gets choked off, and these burning myofascial trigger points erupt. It's tragic, really. The body's desperate attempt to protect itself actually amplifies the suffering. And this creates a really heartbreaking clinical paradox. A doctor might perform an exam, look at the tissue, and think, well, it only appears mildly thin. But beneath the surface, those microscopic nerve endings are screaming. The pelvic floor is locked in absolute spasms. The visible severity almost never matches the sheer agony the patient is feeling. The pain might be invisible to the naked eye, but believe me, it is absolute.
Now we hit Section 3, the chemical sabotage, a medical betrayal. And honestly, this part is pretty shocking.
First, we need to understand a term called osmolality. Put simply, it's a measure of the concentration of particles in a fluid. Why does this matter? Well, because highly hyperosmolar fluids act exactly like a chemical vacuum. They forcefully pull water right out of surrounding cells. Keep that science in the back of your mind. Check this out. The World Health Organization actually established a strict safety guideline for lubricants. They say pH should be around 4.5 and osmolarity needs to be below 1200. Now let's look at the commercial brands on the shelf. Astroglide Liquid, it has an osmolarity over 8,000. KY Jelly is over 2,000. These heavily marketed everyday products vastly exceed international safety limits. And here is the bitter irony. Women are desperately buying these products to soothe their pain, but because they are hyperosmolar, they cause massive cellular dehydration. They are literally sucking the water out of fragile, already dying vaginal cells. This causes the cells to shrink, peel off, and practically invite infection in. They paradoxically worsen the exact condition they claim to treat. It is quite literally chemical sabotage. But there is a way out of the dark.
Section 4. Rebuilding the foundation, the clinical arsenal. Modern medicine does have answers. There's a massive clinical arsenal waiting to be deployed. We're talking local vaginal estrogen, high molecular weight hyaluronic acid, intravaginal DHEA, and ospemifene, which is an oral, non-hormonal therapy. Listen, these aren't just band-aids. Overwhelming scientific evidence proves that these treatments can completely halt that microscopic collapse. So how do they work? Well, local estrogen goes straight to the source, directly restoring cellular proliferation and rebuilding that tissue thickness. But wait, what if you can't, or just prefer not to use hormones? Hyaluronic acid is a phenomenally powerful, evidence-based alternative. It binds massive amounts of water, enhances elasticity, and naturally heals those painful microfissures by mimicking the body's own natural defenses. But remember those locked-up muscles we talked about? The hypertonicity? That has to be reversed too. Pelvic floor physical therapy offers mechanical rehabilitation. Step 1 is manual myofascial release, which physically unlocks that restricted tissue. Step 2 is biofeedback training, literally retraining the nervous system to let go of that chronic guarding. And Step 3 uses progressive dilators to safely rebuild capacity, reversing the hypertonicity and finally restoring pain-free intimacy. And the interventions go even further than that. Fractional CO2 laser therapy uses thermal energy to stimulate deep collagen repair. Systemic transdermal testosterone offers a physiological revival of sexual desire. And crucially, this is so important, there are specialized, rigorously tested, non-hormonal protocols specifically for breast cancer survivors. Surviving cancer should absolutely never mean you have to sacrifice intimacy.
Finally, Section 5, breaking the silence, the ecosystem restored.
As we've seen, the tools exist. The science is totally definitive. And yet, 70% of healthcare professionals admit they rarely or never ask their patients about vaginal dryness. The medical silence is deafening, and it just reinforces the isolation, keeping this entire epidemic hidden in the shadows. We have to completely dismantle this cultural myth. Dr. Carolyn Mills of Northwestern Medicine hit the nail on the head. She notes that many patients consider this agonizing pain just a normal part of aging or surviving cancer. But she says, quote, "It doesn't have to be. Suffering is not a mandatory toll you have to pay for getting older." GSM is a structural collapse, yes, but it is highly treatable. The clinical arsenal is right there waiting. So the question is, will you continue to accept suffering as the inevitable price of aging, or will you demand the medical care required to reclaim your biological ecosystem? It is time to reject the silence, seek out the evidence-based care, and restore your foundation.